Thank you for that kind introduction, Wendy, and it's my great pleasure to welcome all of you to Denver and to this conference today. It's really great to see old friends make new ones and to welcome you here, but more importantly, to welcome you to this conference where you are joining thousands of other people who have come, who have contributed to the hope of children for the future with these diseases. And Wendy had asked me to speak with you today about research, about APFED, about what's happened over the course of the last several years, and how your contributions have really pushed forward a research agenda over time. As she said, that really APFED's one of their main goals is to support research across the country and in many cases across the world. This slide really shows me what your money helps to support. That spirit, the spirit of this slide, showing someone, a young child, who's trying to reach for that elusive prize. It may be a bubble. Maybe it's a glass ball that's falling. Maybe it's a ball that's being suspended. But that energy and that directedness that that young child is really captures the spirit of the research that happens and the money that you support. Well, as through the course of my talk today, I wanted to provide for you 3 chapters talking about research. Many of you haven't ever heard about eosinophilic GI diseases before, and so I wanted to try to introduce those diseases and really talk to you a little bit about what they are and what their impact is. Talk to you a little bit about the barriers of research, and then what your successes are in the contributions that you've made. Well, first, who is it who does this research? And it's, in many cases, as myself and Dr. Putnam, Dr. Markowitz, who are here today, Dr. Atkins and Fleischer, all of the healthcare providers are scientists as well as healthcare providers. We have the great privilege of seeing patients, of asking them questions, of examining them and seeing them as patients who need help. We make observations about ways that we can try to help them. We try to develop hypotheses about ways that we can turn those observations or those problems into testable ideas that we can go on to answer. We test those hypotheses, we obtain data, and then we make conclusions about that data to try to implement them back again into caring for patients. Well, what is research? And our group always hears me talk about this, but again, going back to when we meet you, when we see families and patients, we think about barriers to care. What's keeping us from making the best possible life that you have? How can we improve your life? And we try to identify those barriers to care and go out and knock them down. And we'll talk about that during the course of my presentation. So what are these eosinophilic GI diseases? Well, first, an eosinophil is a cell shown here. This diagram shows that white blood cell that we normally have in our intestinal tract, cross through it except for the esophagus. This is a white blood cell that's present that's thought to participate in allergic responses, but also may participate in maintaining host health. So this slide describes eosinophilic GI diseases. They can be classified according to where those eosinophils accumulate. It might be the esophagus, the stomach, or in the colon. Those cells go there for unknown reason, but it likely is related to an allergic cause. And as Wendy had mentioned earlier, the only treatment that we have to date for these are either eliminating foods or using steroids. Well, why have we not heard about these diseases? And as Wendy had noted previously, back over the last several years, there really has not been very much written. This slide shows the number of articles here over the course of time, and you can see that most of the scientific publications have been published just in the last several years. So it's no surprise that physicians don't know about these diseases because they haven't even been described within the scientific literature yet. These diseases, in particular eosinophilic esophagitis, have been described across the world. So this isn't something that's just unique to the United States. Here we see the incidence or the prevalence of these diseases over here on the y-axis the number of patients that have been diagnosed over time, and one can see that that number has increased, not just here, but in this study from Switzerland. Here we see a diagram of all the places across the United States where eosinophilic esophagitis has been identified. These are the number of patients and the age groups. And there's an emerging trend now that we've engaged our adult colleagues to identify the fact that these diseases do occur in adults as well as in children. Well, this slide shows a diagram of a normal, healthy esophagus, and we wonder why that esophagus turns into an inflamed organ, or one where these eosinophils have accumulated, causing the symptoms of vomiting or abdominal pain, things that your children or you might suffer from. So what are those barriers that keep us from doing the best thing that we can for you? The barriers include the lack of diagnostic criteria. We'll touch on this, and it's an important point because, again, this is an area where APFED has made an important point. The symptoms can be vague, and we still today don't understand the exact mechanisms of these diseases. One often wonders, why are mechanisms so important? If we can understand what causes those diseases, it allows us to develop new treatments instead of just steroids or diet management. Let's talk about this lack of diagnostic criteria. As Wendy had said earlier, there was a lot of mystery surrounding how to make the diagnosis. And because of this, the Pediatric GI Society convened a large number of experts in the area, this area, to establish diagnostic criteria, to bring clarity to that area, to educate and interest new investigators, to engage them, and to finally establish a research agenda to begin to discover new elements. So the FIGRS, or the First International GI Research Symposium, was formed with a number of experts, both MDs as well as PhDs, pediatric and adult colleagues, MDs, PhDs, allergists, pathologists, gastroenterologists, and academics, as well as physicians from private practice, to think about this. And the result of that process that took over about a year to take place was that we developed consensus recommendations for how to make a diagnosis, something that seems rather rudimentary, but until that time really hadn't been the case. And as Wendy said, the research support that's provided for APFED helped to develop these criteria. Well, what else about this diagnosis? We really rely on a cell count in addition to symptoms to make the diagnosis. And some of the research that I'll show you in the next coming slides have started to focus on some of these barriers, some of which have been performed here in Denver. With our colleagues at the Mayo Clinic in Scottsdale, Arizona, we've been able to use not just eosinophil numbers, but also specialized staining to begin to identify those eosinophils within the biopsy samples. And you can see these pink cells here are the eosinophils that are actually much more readily apparent than on this more traditional slide. When we look at a scoring system, indeed the scoring system shown here in different groups of patients and the eosinophilic esophagitis patient shown here, we're able to use that scoring system to identify patients in a perhaps more significant fashion. Well, the symptoms are vague, leading to problems in the way that physicians may recognize the patients who have these diseases. And one of the important symptoms that have been identified is food sticking within the esophagus. But there has been very little in the sense of studies that have truly identified how often or who that happens with. This was a recent study that's in press now, performed here at Children's, in which Christine Hurtado and Rob Kramer have gone back into all of the medical records over a 5-year period to see how many of the children who came to the emergency room with food stuck in their esophagus, approximately almost 700 people, and went back to look at how many of those children ended up having eosinophilic esophagitis. And what they found was, of those 700 children, 10% of those children had food